Hi, it's Michael here from Bayside Headache Clinic again. Today I want to talk to you about, are you having a headache or could it be a brain tumour? Now, a lot of my patients come in and they're quite worried that their headaches and migraines could mean that they're having a brain tumour. And I think that's a pretty understandable worry. But what you need to remember is that brain tumours are actually rare. So this graph shows the number of people per 100,000 of the population who actually experience a brain tumour. As you can see, up to about the age of 40, that's less than 5 people per 100,000. Once you get over 40, that number does increase, but it only ever hits about 20 to 30 people per 100,000 of the population, and that's still pretty rare. Compare that to people who have headaches and migraines more than once a week, and that's about 1 in 7 in the population. The other thing to consider is that of people who do have a brain tumour, only about half of them will actually have a headache that goes along with it. And that's because the brain tumour has to be pretty big before it actually starts to increase pressure within the brain and cause a headache. But headaches and brain tumours do share some similar symptoms. Things like nausea, vomiting, dizziness, and a feeling of confusion or fogginess in the head. So when should you be worried? Well, as we saw on the graph, if you're over 40, there's an increased risk that you could have a brain tumour. So if you're over 40 and you have a sudden onset of headache for no reason, especially if it's accompanied by neurological signs like confusion, sleepiness, light sensitivity, decreased alertness, decreased cognitive thinking, changes in your personality or behaviour, then you should definitely be worried. Also, if you have a sudden onset of headache with a fever, vomiting or nausea and it's not explained by any other illness, or a sudden change in your regular headache or migraine. It's quite common for headaches and migraines to change slowly over time. But if the changes are sudden, then you should definitely seek medical assistance. Also, if you have a history of cancer and you experience new headache, then you should definitely be worried. Or if your headache gets worse with coughing, sneezing, bending down, lying down, or forceful movements. And the new sudden onset of a headache, and it's quickly getting more frequent and more intense, is also a worrying sign. But the most worrying symptoms are the neurological symptoms that I was discussing before. And things like seizures, changes in your vision or hearing, weakness in the arms or legs, difficulty speaking, mood changes, or cognitive loss such as memory problems. But remember, we looked at the graph before. Brain tumours are rare, less than 30 per 100,000 of the population, whereas headaches, 1 in 7 of people have headaches or migraines more than once a week. But what should you do if you're worried? Well, I'd recommend seeing your GP to get a referral for a CT or an MRI scan, and that can rule in or out whether or not you have a headache or a brain tumour. Now, Bayside Headache Clinic is located in the Melbourne area in Australia, and we treat headaches and migraines. So if you get your scan and it comes back negative, then come and see us. We have an 80% success rate in either eradicating or significantly reducing the pain of headache and migraine. You can contact us on 0423 071 971, or you can check out our website at baysideheadache.com.au. We offer a free over-the-phone consult if you are worried about your symptoms and are happy to discuss any issues that you're having. Thank you for your time.